This combination medication is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may be used to treat conditions caused by low calcium levels such as bone loss, osteoporosis, weak bones, osteomalacia/rickets, decreased activity of the parathyroid gland, hypoparathyroidism, and a certain muscle disease, latent tetany. It may also be used in certain patients to make sure they are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, people taking certain medications such as phenytoin, phenobarbital, or prednisone. Calcium plays a very important role in the body. It is necessary for normal functioning of nerves, cells, muscle, and bone. If there is not enough calcium in the blood, then the body will take calcium from bones, thereby weakening bones. Vitamin D helps your body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium, and phosphorus is important for building and keeping strong bones. This medication should be taken as directed by your doctor, typically with a meal to help with absorption. When taking the calcium 600 Vit D3 tablet, it's important to take it with food to help with absorption. If your daily dose is more than 600 milligrams, it's best to divide the dose and take it throughout the day. If you have any questions, be sure to ask your doctor or pharmacist for guidance. If you're using the liquid form, make sure to measure the dose carefully with a special measuring device, and if you're taking the chewable form, be sure to chew thoroughly before swallowing. It's essential not to crush or chew extended-release tablets, as this can increase the risk of side effects. Take the tablet whole, without crushing or chewing. To get the most benefit from the medication, it's important to use it regularly and at the same time each day. If your doctor has recommended a special diet, be sure to follow it to get the most benefit and prevent serious side effects. Avoid taking other supplements or vitamins unless advised by your doctor. There are different forms of calcium supplements available, so it's best to consult your doctor or pharmacist to find the best product for your needs. And remember, if you think you may have a serious medical problem, seek medical help right away. If you experience constipation or stomach upset, it's important to consult your doctor or pharmacist. However, many people using this medication do not have serious side effects. It's crucial to inform your doctor if you experience any of the following serious side effects: nausea/vomiting, loss of appetite, unusual weight loss, mental/mood changes, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the optimal timing to take this medication, it's best to follow your doctor's instructions. Typically, it is recommended to take calcium 600 Vit D3 tablet with a meal to help with absorption. The daily dosage will also be determined by your healthcare provider based on your individual needs. Remember, always consult your doctor before starting or stopping any medication. Before taking calcium 600 Vit D3 tablet, make sure to speak with your doctor or pharmacist about any allergies you may have. It's important to discuss any inactive ingredients that could cause allergic reactions or other problems. You should also share your medical history, especially if you have high calcium or vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or certain immune system disorders. It's also important to note that chewable tablets may contain sugar or aspartame, so if you have diabetes or PKU, speak with your doctor or pharmacist about using this product safely. If you are pregnant or breastfeeding, it's essential to consult your doctor before taking this medication. As always, it's important to discuss the risks and benefits with your doctor. Remember to follow the recommended dosage and consult with your healthcare provider about the best time to take this medication. When taking calcium 600 Vit D3 tablet, it's important to be aware of potential drug interactions. Certain medications, such as digoxin and phosphate binders, may interact with this drug. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be cautious of other medications that may decrease the absorption of calcium and vitamin D, such as tetracycline antibiotics, bisphosphonates, and certain antibiotics. It's best to separate your doses of these medications from your doses of calcium/vitamin D and ask your healthcare provider for guidance on finding a dosing schedule that works with all your medications. It's also important to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium, phosphate, or vitamin D. Be sure to ask your pharmacist about using these products safely. Additionally, avoid using medications containing calcitriol while taking vitamin D, as they are very similar and may interfere with certain lab tests, potentially causing false test results. Make sure to inform all your doctors and lab personnel that you are using this product. If someone takes too much of this medication and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea/vomiting, loss of appetite, mental/mood changes, headache, drowsiness, weakness, tiredness. Always be cautious and seek help if you suspect an overdose. When taking calcium 600 Vit D3 tablet, it's important to have regular medical tests to monitor your calcium levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. You can also get vitamin D from fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body can also produce vitamin D when exposed to sunlight. To increase your calcium intake, consider consuming dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables like broccoli, spinach, and bok choy. Calcium-fortified foods like orange juice can also help. In addition to taking the supplement, you can reduce your risk of bone disease by staying physically active, avoiding smoking, and limiting alcohol and caffeine intake. Remember to speak with your doctor about the optimal timing and dosage for your specific needs. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Keep your calcium 600 Vit D3 tablet at room temperature, away from light and moisture. Make sure to store it in a safe place, away from children and pets. When you no longer need it or when it's expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.